The purpose of this presentation is to share information on hearing health and the precautionary measures all of us should practice daily. This information is provided by the National Association of Schools of Music, NASM, and the Performing Arts Medicine Association, PAMA. In working towards a degree in music, you are joining a profession with a long and honored history. If you're serious about pursuing a career in music, you need to protect your hearing. A quick disclaimer. The information in this presentation is not a substitute for professional medical judgments or advice. If you are concerned about your hearing, consult a licensed medical professional. One option is the Towson University Institute for Wellbeing. Call 410-704-7300. Throughout our presentation, we'll be referring to noise-induced hearing loss. Noise is a general scientific term for sound. Music is simply one kind of sound. In science-based work, all types of sound, including music, are regularly categorized as different types of noise. When a loud noise enters the ear, it poses a risk to the ear's inner workings. A very loud sound, an explosion for example, can actually dislodge the tiny bones in the middle ear. In many cases, this damage can be repaired with surgery, but loud noises like this can also send excessive sound into the inner ear, causing permanent damage. The inner ear, also known as the cochlea, is where most hearing loss tends to occur. Inside the cochlea are tiny hair cells that are responsible for transmitting sound waves to the brain. When a loud noise enters the inner ear, it can damage the hair cells. The extent of the damage to these cells is directly related to the length and frequency of a person's exposure to loud sounds over long periods of time. Because noise-induced hearing loss is painless, you may not realize that it's happening at first. But if you don't start to take precautions, your hearing loss may eventually also affect your ability to perceive both speech sounds and music. It is also very important to understand that these hair cells in your inner ear cannot regenerate. Any damage done to them is permanent. At this time, there is no way to reverse the damage. Not all noise-induced hearing loss is necessarily permanent. Sometimes, after continuous prolonged exposure to a loud noise, we may experience noise-induced temporary hearing loss. During temporary hearing loss, hearing ability is reduced. Outside noises may sound fuzzy or muted. Normally, this lasts no more than 16 to 18 hours, at which point your hearing levels will return to normal. Often during temporary hearing loss, people will experience tinnitus, a medical condition characterized by a ringing, buzzing, or roaring in the ears. Tinnitus may last only a few minutes, but can also span several hours, or in many instances, last indefinitely. If you experience a series of temporary hearing losses, you may be well on the way to permanent damage. Remember the 3 Ds of hearing health. Decibels. The louder the noise, the greater the damage. Duration. The longer you are exposed to a loud noise, the greater the potential hearing loss. And distance. The closer you are to the source of a loud noise, the greater the potential damage. At this point, it helps to have some frame of reference. How loud are certain noises? Consider these common sounds, their corresponding decibel levels, and the recommended maximum exposure times. A whisper is 30 decibels. There's no risk involved at this level of sound intensity. Your average conversation is around 60 decibels. Again, there is no risk. An alarm clock is 80 decibels. No real risk, but it would certainly be annoying if you listened to it for very long. 85 decibels is the number to remember. Sounds above the 85 decibel threshold pose a potential threat to your hearing. Blenders, food processors, and pianos. Blow dryers and cellos. Oboes and trains measure 90 decibels. The recommended maximum exposure time for 90 decibel sounds is around 2 hours. Music players at full volume. Lawnmowers, clarinets, and snowblowers come in at 100 decibels. The recommended maximum exposure time for these items is 15 minutes. Before you give up practicing your instrument, remember there are ways to reduce your exposure. For instance, turn down the volume on your headphones. Did you know that normally music players generate about 85 decibels at 1/3 of their maximum volume, 94 decibels at half volume, and 100 decibels or more at full volume? Translated into daily exposure time, 85 decibels equals 8 hours, 94 decibels equals 1 hour, and 100 decibels equals 15 minutes. Here are some other figures for you. Rock concerts, certain sporting events, and trombones have been measured at 110 decibels. At full volume, the recommended maximum exposure time is 2 minutes. Jet planes at takeoff, 120 decibels. Sirens, race cars, and jackhammers, 130 decibels. A peak orchestra hit has been measured at 137 decibels. Gunshots and fireworks at close range, 140 decibels. When you're dealing with sounds that produce between 120 and 140 decibels, you're putting yourself at risk for almost immediate damage. Use protective ear coverings. Better yet, avoid your exposure to these sounds altogether. It's true that musicians are exposed to elevated levels of sound when they rehearse and perform music, but that doesn't equal automatic risk for hearing loss. Take a typical practice session on the piano. When taken at close range to the instrument, a sound level meter fluctuates between a reading of 60 and 70 decibels. That's similar in intensity to your average conversation. There will be moments when the music peaks and this level rises, but these moments are not sustained over several hours. Or are they? Many students practice the technically difficult, loud, and emotionally satisfying climaxes of the repertoire again and again, sometimes for hours at a time. In addition, certain groups of instruments tend to produce higher sound levels. For example, string sections tend to produce decibel levels on the lower end of the spectrum, while brass, percussion, and wind sections generally produce decibel levels at the higher end. Safe exposure times are most easily understood in the following manner. Plus 3 decibels, safe exposure time halves. Minus 3 decibels, safe exposure time doubles. That is because decibel is the scientific measurement of the sound pressure and not of the perception of how loud the sound is. You may scarcely be able to distinguish between 94 and 97 decibels, but the difference in safe exposure times is a factor of 2. The distance between you and the sound source also makes a significant difference. There is a 6 decibel reduction when the distance to the sound source is doubled. So while a flautist in your orchestra might have her ear 4 feet away from the business end of a trombone, belting out 110 decibels, with a safe exposure time of about 2 minutes, the violinist in the next row is only experiencing 104 decibels because she is 8 feet away. Her safe exposure time will be 4 times as long. The next row of violins will be 3 times as far away, and their safe exposure time will be 9 times longer. The conductor, who is 16 feet from the sound source, may safely be exposed to that sound 16 times louder than the flautist, or over half an hour. Keep in mind that this applies to reflected sound as well. The size and reflectivity of your practice space will have a profound impact on safe practice times. Remember, the time limits given are for continuous daily exposure. Therefore, choices must be made taking all of the above factors into account. A weekly ensemble rehearsal may impress with several minutes of loud music, but may pose less risk than hours of daily practice at high intensity or listening with earbuds at high volume. Let's talk about how you can be proactive when it comes to music and hearing loss. It's important to think about the impact noise can have on your hearing health when you attend concerts, play your instrument, adjust the volume of your car stereo, or listen to music using speakers or headphones. Please keep in mind that putting a speaker inside or right next to your ear is one of the worst things you can do, and that the volume levels are going to creep up beyond safe exposure very quickly. Take breaks whenever you can. Switch to speakers when the situation permits. Use an equalizer to lower mids and highs. between 1 and 10 kilohertz, but especially between 3 and 4 kilohertz. Resist the temptation to keep raising the volume, but if you do, remember to lower it again for the next session. Put a marker on your volume knob or remember a reference number for 1/3 volume. Here are some simple ways to test if the sound source is too loud. It is too loud and too dangerous when you have to raise your voice to be heard. You can't hear someone who is 3 feet away from you. The speech around you sounds muffled or dull after you leave a noisy area. You experience tinnitus, pain or ringing in your ears after you leave a noisy area. When evaluating your risk for hearing loss, ask yourself the following questions. How frequently and for how long am I exposed to noises and sounds above 85 decibels? This would include not only music, but also noise experienced while commuting, etc. What can I do to limit my exposure to such loud noises and sounds? What personal behaviors and practices increase my risk of hearing loss? How can I be proactive in protecting my hearing and the hearing of those around me? Here are some simple ways to reduce your risk of hearing loss. If the sound is too loud or too close, get away from it if you can. Avoid practicing or rehearsing in small, hard rooms, and take breaks. Keep a safe distance from loud sound sources such as concerts or in rehearsals. Keep the volume of your music, especially headphones, at a safe level. Use earplugs or earmuffs in noisy environments and when using noisy equipment. There are readily available economical examples of earplugs suitable for musicians. They offer 12 to 20 decibels of sound attenuation across all frequency levels so that this change in sound quality is minimal. Their regular use should potentially quadruple your safe exposure time in practice sessions and rehearsals. I hope you learned something useful from this talk. Stay safe and protect your hearing.